Ontario's action plan responding to COVID-19 outlined the government's first steps to protecting our public health and support for people and for jobs. You will see that we this is a first step, but we'll continue to work diligently with all levels of government, experts, the health sector, financial institutions, and continue to partner to respond swiftly and effectively to this outbreak, so that all the people of Ontario know that they are supported. I've spent a lot of time speaking to small businesses, both on the phone, through virtual conferences, various consultations with the Chamber, and Embrace and Become in Innisfil and Startup in Innisfil as well. And this is one of the measures you saw in the economic update. You saw that $17 billion in total was given, but if you break that down, it was 3.3 to support health, 3.7 billion to support people and jobs, and 10 billion to support businesses so that they have cash flow. It's something that I heard loud and clear is cash flow is very necessary. So there's a lot of deferrals that small businesses had asked for, things like property tax deferral, impact assessment, which was supposed to happen this year, has also been deferred. But there's other taxes which they may owe to the provincial government. There's a slew of them that we've included that can be deferred. They include things like the employer health tax, the tobacco, fuel, gas tax, insurance premium tax, the retail sales tax on insurance contracts and benefit plans, and of course, spirits. All of these things are really important to our local economies because we know if government can help local employers, then everyone will be able to meet their obligations. What I mean by that is that if you're working for a business or your employee, you want to make sure that you can pay your bills at the end of the day. And our government has been very clear, we won't leave any stone unturned. And we do want to support people in all different sectors, including the vulnerable sector. One of the levels of government we work very closely with is, of course, our municipal partners. And we also want to ensure that they have the resources and the tools that they need, both financially and healthcare-wise. So there has been investments made at the municipal level to assist with things like education tax deferrals so that they don't have to pay the provincial government right away. It allows them to have a little more liquidity in their budgets. The other things we've helped them with is there was a large influx of money that was given to municipalities to help the vulnerable sector, like our shelters and, of course, food banks and charities. They are hit most at this time. So what anyone can do is really give back to the vulnerable sector, help out our shelters, help out our food banks. So we know that individuals can take action and do those things, but we also wanted to ensure that they have stability through the provincial government in order to have the funding that they need to support things like shelters, property tax deferrals, and of course, education deferrals. Our government is very fortunate. We do try to break down the silos as a team as much as possible. So here locally, you can see I'm working from home, but my staff are also working 24/7 as well from their homes. They are keeping safe. They are exercising physical distancing, and so are many different folks within the government. If I need to speak with a minister, there's nothing we can't accomplish via a quick phone conversation over a Skype or Zoom. And likewise with others of my colleagues. The support for one another has been tremendous because, when we're out there saying we're all in this together, we really live by it as well. You've seen the tremendous support the Premier has given to all Ontarians, but within our own caucus, we've been really helping one another, and it's been phenomenal. I think it's actually brought us even closer together than we were before. But you've seen how much can be accomplished when you can work virtually. I'm very fortunate I have that ability. I know others don't, so I do spend every ounce of my day helping as many people as I can when and where I am able. And that's my way of giving back because I'm in a very blessed and fortunate situation myself. And so are so many of my colleagues. But we are trying to get as much as we can done. As you know, we did recall the legislature when we needed to, and of course, prepared to do those measures again if we need to pass further legislation. Just because the door isn't opening it up doesn't mean the phone lines aren't open. It doesn't mean we're not responding to emails. My office is certainly still open to servicing all the residents of Barrie-Innisfil. Please do reach out by email or by phone. We try to get back to you as soon as possible. And I'm very fortunate to be surrounded by a great team, great staff who are very diligent at helping individuals as fast as we can. The Ontario government has invested a lot in terms of assessment centers. It's been very important to keep rolling out more assessment centers as well as the equipment they need to do their job to help curb COVID-19. One thing you've seen us do is not only open more self-assessment centers, but also being able to do things online. It's really about triaging. I'm not a healthcare expert, but we certainly, as a government, rely on healthcare experts. And what we've learned from them is that you need to triage, triage, triage. And so what you've seen is we have online tools that if you think you have symptoms that are COVID-19 related, there's a walkthrough process we've updated. This is the second time we've updated the online module, so it's very accurate, and we'll continue to build on that module as we find out more things through the medical field. If you go to self-assessment center, they'll also be able to give you the assurances whether or not you need to get a swab to test yourself, whether you're negative or positive for COVID-19. But this is all to help our frontline workers in our local hospital, like Royal Victoria Hospital, because we want to ensure that the people that are going there are the folks that are in need. And this is going to help our entire healthcare sector and the people that are feeling the pinch the most. I would say if you have an idea out there, if you've seen some gaps, if you've seen something that a certain level of government or the private sector or local businesses and community members haven't been able to address, and you have an idea of what we can continue to do to support one another during COVID-19, please reach out with your ideas. Likewise, your questions. We're here for you, and it's been very clear from our Premier Doug Ford and everyone across Ontario that we've got each other's back, and we got to continue to have each other's back. And so, if you need help, please reach out. If you're a business and you have questions, you're unsure if you're essential or not essential, we do have a phone number that's available for you to phone. So please look out for that, as well as if you are in the work sector right now and you feel that you are not being provided with protections, it's your employee's legal obligation to ensure that you have a safe workspace. There's also numbers you can look for online that allow you to, in order to bring that to the attention of the province. But know that, again, there's no rock we will not turn over in order to help Ontarians. We're lucky that we are in a better fiscal situation than most provinces. And we've historically put in a lot more contingency funds than any time in Ontario's history. So if need be, we do have a contingency fund for our health sector directly to COVID-19. Aside from that, we have a contingency fund for our finances. And this will put us in a better position to respond fiscally to needs and address the resources that are in need, like our protective equipment. So I've heard a lot about PPEs and having them to our first responders. And certainly the investments have been made, both in the first part of funding that our government announced, $304 million, and the additional funds that are being put out now, whether they're paramedics or nurses, our home care facilities, our paramedics, everyone is being supported by the provincial government. I am a member of the Estimates Committee at the Ontario Legislature, and so when the Minister of Finance does go out and does announce historic funding to respond to COVID-19, one wants to think what this is going to mean for economy. But we are in a good spot. We did borrow a bit of funds before in terms of a bond market, and we're in a position to probably borrow more for the next cycle. Just to give you an idea of what this means for our deficit for 2020-2021, it means we're going to have a $20.5 billion deficit. But that's why we've executed historic prudence, and we put in the contingency funds needed that put us in a hopefully better fiscal shape than others. But again, right now, the key is to respond to this healthcare pandemic, help businesses who are unfortunately a casualty of this pandemic. And certainly on the Estimates Committee will be very interesting to see how we've come out of that. But I think this is a very good opportunity for any government to understand what the lessons learned are and how do we equip ourselves to respond to this in the future.